Hi, I'm Danna A, and I'm partnering with Claudia Moreno, and we are going to talk about leukemia. I've researched the second part of the presentation, so let's begin with the immune response. So, from what I've researched, the immune response can be either passive or active. As we know, leukemia is cancer on the blood. We do not know the certain cause for the disease, so it may be possible heritage from parents or grandparents or even before them. But it is also proof that leukemia may also be acquired from certain chemicals. This meaning it's infected or transmitted by external means. Now we have how to prevent contagion. There isn't a way. There isn't a certain way to avoid leukemia, but what it is always recommended is to always take care of yourself, stay away from tobacco, and exposure to pesticides and industry chemicals may help a lot. These tips are because some factors that put a major risk the persons are exposure to intense radiation or to some industry chemicals. Now we have critical barriers. We have the mechanical, the chemical, and the biological ones. In the mechanical, we have skin, hair, and mucous membrane. In the chemical, we have tears, sweat, mucus, and saliva and breast milk. And finally, in biological, we have the bacteria. Now we have the treatment. There are various types of treatment. It also depends a lot on the factors and type of leukemia the patient has, because it can vary a lot on the difficulty of the disease. First, we have the chemotherapy, which is the most common one. Then we have the radiation therapy, that it may be somehow risky, but it is also considered as a treatment. Then we have the bone marrow transplant, the target therapy, and the immunotherapy. And finally, we have complications. When I researched, there were lots of complications, but so I just wrote the main ones that may be the most common in the disease. First, we have intense pain, which can be bone pain or peripheral neuropathy. Then we have osteonecrosis of the jaw. Then we have kidney impairment, myelosuppression, which can be anemia, neutropenia, and thrombocytopenia, and finally thrombosis and embolism. And finally, we have the references where we have the sources where we got our information. And that's all. Thank you for watching our presentation.